A gentle truth we all must face. There's a quiet truth that many families avoid talking about, but understanding it can bring peace, dignity, and preparedness to those we love. As our parents, grandparents, or elderly relatives grow older, subtle changes in their behavior, body, or routine can sometimes signal that they may be entering the final chapter of their life. These aren't always easy to see, and certainly not easy to accept, but when noticed with love and care, they can help us offer the right support, make meaningful memories, and ensure that our elders are comfortable, safe, and honored. In this video, we'll gently explore 5 important signs that an elderly person may be in their final year of life. These aren't guarantees, but they are patterns observed by doctors, caregivers, and hospice professionals. Knowing them doesn't mean giving up hope, it means being present with compassion. Let's begin. Sign number 1, noticeable weight loss and decreased appetite. One of the most common and early signs that an elderly person may be entering their final year is unintentional weight loss. This isn't about dieting or eating less on purpose, it's a quiet withdrawal from food. You may notice they no longer enjoy favorite meals. Their portions shrink. They skip meals altogether. This often happens because the body, nearing its natural end, begins to slow down digestion and the demand for calories. Sometimes the sense of taste or smell fades, or chewing becomes difficult. If combined with muscle loss or visible frailty, it's a red flag that the body is preparing for rest. While this change is natural, it's important to ensure they stay hydrated and comfortable. It's also a moment to gently shift from trying to fix the issue to providing comfort food and emotional presence. Meals become less about nutrition and more about love. Sign number 2, increased sleep and withdrawal from activities. Have you noticed your loved ones sleeping much more than before? Perhaps they spend long hours in bed or fall asleep in the middle of the day. They might skip activities they once enjoyed, watching TV, chatting with family, or even short walks. This is a major sign that the body is conserving energy. As organs slow down, so does the need to stay active. It's not just physical tiredness, it's an emotional withdrawal as well. They may speak less, seem disinterested, or want more quiet time alone. This can feel alarming, but it's often the body's natural way of preparing. What's most helpful now is presence without pressure. Sit with them. Hold their hand. Let silence be sacred. Let them rest without guilt. This phase is not about doing, it's about being. And your calm presence can mean more than you know. Sign number 3, confusion, forgetfulness, or emotional changes. Even elders who were mentally sharp can experience sudden confusion, forgetfulness, or mood shifts in their final year. They might forget names or places, lose track of time, or ask the same question repeatedly. Some may hallucinate or talk to people who aren't there. Others may become unusually emotional, restless one day, deeply silent the next. These changes can be symptoms of reduced blood flow to the brain or simply the body's declining systems. It's heartbreaking to witness, especially when they don't recognize loved ones. But it's important to respond with patience, not correction. Instead of saying, "Don't you remember?" try saying, "That's okay, I'm right here." Their reality is shifting, but your love is still their anchor. Seek medical advice if symptoms worsen, but emotionally, know that this phase is part of a deeper process of letting go. Sign number 4, changes in breathing, skin, or body temperature. The body speaks in subtle ways near the end. You may notice shallow breathing, longer pauses between breaths, or irregular rhythms. Sometimes there's a soft wheeze, even when there's no illness. The skin may feel colder, especially at the hands and feet. It can take on a pale or bluish tone, especially at the extremities. These signs mean that circulation is slowing and the body is gradually retreating inward. For some, hands may tremble or swell slightly. You might notice dryness in the lips or skin. These are signs of systemic decline, not pain. Comfort matters most now: warm blankets, soft lighting, and peace. If medical help is needed, palliative care professionals can make this time more comfortable. But emotionally, it's a time to be soft, slow, and present. These changes don't signal fear, they signal transition. A passage. Sign number 5, a sudden surge of energy or clarity. Here's something both surprising and profound. Some people experience a final surge of energy or clarity shortly before passing. It may last minutes, hours, or even a full day. A loved one who was barely responsive may suddenly wake up, speak clearly, eat well, or ask to see family members. They might reminisce, smile, or even crack jokes. This is often referred to as terminal lucidity. It's not a sign of recovery, but a final gift. Families often describe these moments as spiritually moving and deeply meaningful. If this happens, embrace it fully. Sit close. Say the things you've been holding in your heart. Listen to their words. Be present. After this moment, many elders grow quiet again and pass peacefully within days. It's not a miracle, it's a farewell. A final exhale of light before the body lets go. Cherish it. No one wants to say goodbye, but knowing what to expect can help you say it with love and peace. If you notice these signs in someone you care for, remember, your role is not to fix them. It is to honor, accompany, and support them. Let every visit be a blessing. Hold their hand. Tell your stories. Play their favorite songs. Touch their face gently. Let them know they mattered, still matter, and always will. And when the time comes, let your grief be full of gratitude. Because to love someone until their final breath is one of life's greatest acts of grace. If this video helped you, share it with others. These are not signs of fear. They are signs of life completing its sacred circle. May we all walk that path with courage.